I'm Kate. I blog at thehippieChristianMum.com, and this vlog is actually quite a personal vlog. It's quite a personal thing to talk about. I found a lump in my breast, and you might think it's weird to share something so personal so publicly, especially if you know me. You're probably wondering why I'm doing a video about something so personal. I wanted to share it because that was the whole reason my blog began. I'd been thinking about blogging for a good 2 years. I'd never had any reason to start or any reason to trust my capability that I could do it. And then when my baby was born breech, and nobody knew he was breech until he was born, and he had to go to intensive care. I spent the nights without him on the maternity ward, Googling for other people's experiences, for other women's experiences of NICU, for other women's experiences of home births that didn't go to plan, for breech births, and there wasn't much out there because it's quite rare. I started the blog when the baby was 3 months old because I wanted to put my experience out there for any of the women who were doing the same thing. That's why I'm blogging today about finding a lump in my breast. So I thought I'd start with the process. So I first noticed the lump when the baby was about 6 weeks old. So that is about 10.5 months ago now. I noticed the lump because I'm breastfeeding, so I'm handling my boobs quite a lot. So, but not only that, it was a very obvious lump. It felt the size of, say, a ping pong ball, around there. My first port call actually was Galactocele League, which is a mother-to-mother support group for breastfeeding mums. I went anyway for breastfeeding support, but I did bring it up in the group discussion as well that I'd found this lump. And because it could be a galactocele, which is basically a milk-filled cyst. So anyway, they advised me to go to the GP, so which, you know, I was putting off. Booked in with the GP. Actually, I didn't book for me, I booked for the baby because he had silent reflux, and I was due to see her again, I think, for a repeat prescription for him. So I just mentioned it then. She examined me. She wasn't concerned at all. I think with my age, I'm 33, and the fact that I'm breastfeeding, she just kind of said, well, you're breastfeeding, your breasts are going to change a lot while you feed him. And she said lumps are actually really common. It's very rare that it's breast cancer. But I don't know, I guess I expected it to go away or something, and it didn't. So, and it was just there, and it was bothering me, and I just kept thinking, everything you read about cancer says it's better treated if it's caught early. But that what if kept creeping in. What if it is something more? You know, what if it is a symptom of something else, something, you know, breast cancer, and you've left it for these nearly 10 months? That's, you know, that's not good. So I went back to the GP, and because by then we'd moved in between, so I had a new GP, and I explained to her that the previous GP wasn't concerned. I don't sleep very well anyway, but I was finding that I was thinking about it every time I lay my head down, so that's a good sign to me that something's really bothering me. So she examined me. The baby was actually crawling underneath the bed I was on, and she wasn't concerned either. But for her, she said, as you're feeling really concerned about it, then I will refer you. I think from the GP appointment to my appointment date at hospital to be seen was about 2 weeks. But then once that hospital appointment was booked, I think something about having to go to the hospital just really freaked me out, and then I just couldn't stop thinking about it. So I was just thinking about it all every day. And then, they phoned up to cancel. Yeah, the hospital phoned me up and said I was actually booked in for an evening clinic, which would have worked really well because Rich would have had the kids while I went down on my own in the evening. But the radiologist that ran it had phoned in sick. So, but luckily for me, they fitted me in the following morning. So the appointment was at outpatients. First of all, I got seen by a doctor. She introduced herself as a doctor. and I was praying that it was going to be a female doctor, and sure enough it was, thank you Lord. And she had a medical student with her. She asked me if the medical student could come in. Automatic response is no, because it's like a really personal thing, and having both my children, I did state in my birth plans that I didn't want any students there, because for me it was very personal and private to me, and I just wanted it as less people there as possible, which on my second birth, you know, I look around and there's paramedics and all sorts, but anyway, because I thought, I don't know, I just thought it would be really helpful to her as a breastfeeding mum, you know, my age. So I said yeah, so she came in, this was fine. But the first doctor then said, I'm going to go fetch the boss, she said, which I knew would be a big fella, and it was a bloke, but he was really nice, and she said they always do, it was protocol, I'm not so sure. He examined me as well, and he asked me a few questions, you know, any of the symptoms, have you ever had lumps before, did you breastfeed your daughter and have any lumps then, has it grown, has it changed, has your nipple changed shape or inverted, has the skin on your breasts changed at all? Mine is no, so I think that bodes well. So he examined me, he wasn't too sure about it, so then he said, right, we're going to put you forward for a scan, which was all right there and then. So I went back out into the waiting room, they called me back in really quickly for an ultrasound. So a different doctor, was another lady doctor, different room, led back on the bed. She did an ultrasound scan, just the same as if you've had a baby and you have your scans. She wasn't too sure about it. She said it looked bigger than she thought it was. So she said we're going to try and aspirate it, which just means fine needle aspiration. The needle, it didn't hurt. It wasn't even like a sharp scratch like giving blood or taking bloods. It was less than taking bloods. So she was scanning at the same time as with the needle, and she couldn't drain it. So she said she didn't think it was a galactocele then, because it wasn't, you couldn't drain it. So she thought it was probably a fatty lump. She said it just happens. Sometimes the cells get together and form a fatty lump. But she said, as we don't know what it is, then she wants to take a biopsy. Again, I thought she'd send me off and call me back. No, she did it all there and then, and prepared the anaesthetic, which breastfeeding, obviously I was a bit concerned about. She didn't seem to have any concerns whatsoever, and she did confirm 3 times, yes, it's fine. And I asked her what the drug was, and she just said, I didn't say what's the drug, I said what is it, what is in the anaesthetic. And she said the anaesthetic is fine to breastfeed, it's the same as something you would have if you had a fill-in. The anaesthetic was a sharp scratch, just like any other needle you would normally have. Then the biopsy machine is like a punch, it sounds like a clip or a small bang, like a punch. But she showed me that beforehand, before doing the anaesthetic and everything, because she said everyone jumps. Biopsy machine, it's like a small box. And the radiologist was helping. So they did that. They took 3 like punches of the thing and then put a plaster on. And then she just said to come back on in 3 days. Yeah, 3 working days for results. So, and that was that. Go book an appointment for Monday morning. We'll get your path, she said, send it to the path lab. Pathogens, I guess. We'll get your results back, and Friday, she said, and then we'll discuss it in our Monday lunchtime meeting, and then we'll see you in the afternoon clinic to tell you what the results are. But she said, we're not worried. She said, we think it's either a galactocele or a fibroedema. And actually, in fact, since going there, I feel much better about it, because I'm just not so worried about it. I just kind of feel like the odds are in my favour, and I think it's going to be a fatty deposit tissue lump thing. So we've got the results I've got the results Monday. So I'll film then, and I'll tell you, I'll take you with me, and I'll film it, and you can come along with me as it happens, kind of thing. So that was the process. So very, very quick. And you know, very well done. Oh yeah, with regard to the breastfeeding, then I got home I fed the baby on the other breast. He's come up to 1 now, so he's not feeding constantly, just like 2 or 3 times in the day really. So it wasn't until the afternoon, so I'd say probably 3 or 4 hours, that he fed off the affected breast then and the plaster was actually over the nipple a little bit, so I wasn't sure I was going to cope. But it was totally fine. It kind of ached a little, but it wasn't painful. Baby didn't even seem to notice any different. They did say that some blood might go through into my milk, which sounds really gross, but I mean, it's only what you'd get if you had really sore nipples. If you're dealing with cracked nipples. He didn't seem bothered at all, didn't taste funny or not want to feed or find the plaster difficult. It was totally fine. I noticed on the school run, I think it was when the anaesthetic started wearing off, so I had the procedure probably about 11 in the morning, then around 3, half 3, when it started really aching, was quite sore. And then it was quite sort of sore and tender all that night, but the baby just breastfed fine through the night. And then the next day, I took the bandage off, the plaster off, and it started to get better. As soon as I took the plaster off, it felt much better. And then it started bruising up. It was nice rainbow of colours, a little bit black the first day. Now what are we now? 5 days in. This is day 5 after the procedure and after the biopsy procedure. There was hardly any cuts, by the way. When I took the plaster off, I wasn't sure if it was going to be like an open hole or what. It was like a little nick, like a shaving cut, yeah, it was fine. Couldn't see anything. Couldn't see any milk coming out of it or anything, thankfully. And it healed it really good. And then, so today it's kind of like greeny bruise, but it's not even really sore today at all. So, yeah, it's totally fine. Don't worry if you have to go for this procedure. It's a bit sore and tender after, but it's not terrible. It's fine. And the anaesthetic makes it all go numb and tingly, so you don't feel the biopsy. Thoughts and feelings, as I said, the week leading up to the hospital appointment was probably the worst, where I was sort of getting really worried. Obviously quite a big lump, so I notice it day in, day out, especially breastfeeding 4 or 5 times a day. You can't not notice it, so it was on my mind a lot. But now this side of the biopsy, feeling really much more positive. I feel like I'm going to go on Monday and they're just going to be like, yeah, it's a fatty lump, just like basically it's more common to have a breast lump, that is benign. So that's all of that. So I hope if you've got this coming up or you're worried about going to the GP with a lump, that helps put your mind at rest some, because I know it's a personal area and it can be embarrassing. I guess as a breastfeeding woman, I'm kind of used to handling my boobs. And I'm sort of, I don't know, second time I'm a bit more long in the tooth and I'm a bit more like, well, boob's a boob. Just if you want a female doctor and request it, they're totally fine with that. I'm sure there will be a female doctor. If you don't want the medical student there, don't feel bad about saying no. It's personal to you. You've got to feel comfortable. And I hope that kind of helps set your mind at ease at all, or maybe persuade you to go book that appointment. So good luck. Thanks for watching. Thanks for listening to me blathering on, and I will see you Monday with the results, which I'm sure will be fine. So thank you. Bye. Hiya. So it's results day today. Sounds like A-level results or something, doesn't it? I've had a biopsy of a lump that's in my breast, and I'm finding out what the results are today. The consultant and the doctors were pretty convinced and quite assured that it was probably either a galactocele, a milk-filled cyst, because I'm breastfeeding, or a fibroedema. I don't know if that's the right term, but basically a fatty lump that is benign. So I think it's probably one of those two. The odds are that it is, and I'll take you along with me later and to find out. So yeah, catch you later. Bye. Oh well, there we are. I'm at the hospital. It's all fine, just as we thought. The consultant thinks it's a milk-filled cyst, a galactocele, because he said that the biopsy was clear of anything nasty, he said, but it also found a cell wall. So I think that suggests, means that it's like a full cell, rather than like a cluster of cells. So he said, I want to reassure you, but to call you back in 6 weeks, just to make sure and check it again, which kind of threw me off a bit. I was like, well, is the biopsy not definitive then, kind of thing? And he said no test is 100%, so he said it's just buckles and braces. So I've booked in for another 6 weeks, so it's another just over a month, obviously, to just make sure that it's nothing else, I suppose. But yeah, feeling very reassured. I'm just going to crack on now, forget about it. Yeah, so it's good. Praise the Lord. Thank you, God. You're feeling good. So yeah, just go home now and continue on with my day. I've got to get going. So yeah, thanks very much. Feeling really pleased, and I hope that somehow perhaps helps you if you need to go for investigations as well. Good luck with everything. Thank you very much. Bye.